Good afternoon. My name is Christina, and I will be your conference operator today. At this time, I would like to welcome everyone to the Building a Culture of Health, the Leadership Role of the National Association of Hispanic Nurses. All lines have been placed on mute to prevent any background noise. After the speaker's remarks, there will be a question and answer session. If you would like to ask a question during this time, simply press star, then the number 1 on your telephone keypad. And if you would like to withdraw your question, press the pound key. Thank you. Winifred Quinn, Director of Advocacy and Consumer Affairs, you may begin your conference.
Well, Christina, thank you so much. And good afternoon and good morning to the folks on the West Coast and farther west. It is a pleasure to have you here today, and thank you for joining us. So today's webinar will include a review of the Robert Wood Johnson Foundation's County Health Rankings and the roadmap focused on the Hispanic and Latino communities. Then we will learn more about the National Association of Hispanic Nurses, also known as NAHN. We will hear about their mission, their history, the leadership initiatives that they have, and activities that they have focused on building a healthier America. We will also discuss non-funded grants focused on mentorship and promoting academic progression among Latino and Hispanic nurse students. And we will hear how NAHN is a member of the Campaign for Action's Diversity Steering Committee, and learn how the Campaign for Action coalitions can get involved with and or become members of NAHN. So ultimately, we're trying to integrate everybody's work and align our goals. So this webinar is part of a webinar series describing how nurses are leading a culture of health and health equity, with an emphasis on the ethnic and racial minority nursing associations and men in nursing, and how their members have identified effective nursing interventions to improve their community's health. Before we go any further, I do want to mention that we are recording today's webinar, so if you miss a section or would like to pass it on to a colleague, which we highly encourage you to do, please go to campaignforaction.org. So that's www.campaignforaction.org/webinars. And as Christina noted, we will be taking questions over the phone at the end. However, we do encourage people to send us questions, and you can send them to everyone in the chat function. So when you type in a question and you want everybody to see it, make sure that you pull down the options and that you send it to everyone. If not, your question will go to Scott, and we will pose it at some point. So with that, I am very happy to hand over the webinar to my colleague and friend, Dr. Adriana Perez.
Great. Thank you, Dr. Quinn. I also want to thank Scott Tanaka with our Center to Champion Nursing in America team, who has so kindly organized today's webinar. Thank you, Scott. And I also want to welcome our attendees and encourage everyone to write down questions as they come up. We have 4 presenters today, and they will all present at once, so questions will be at the end. So I encourage you to use our chat box as you hear their slides and content. Next slide. Today we're excited and thankful to the National Association of Hispanic Nurses for sponsoring continued education credit for today's webinar. Next slide, Scott. Thank you. A total of 1.8 CEs will be provided to attendees, and in order to receive the certification, please contact director@thehispanicnurses.org. Next slide. As I said, we're excited to kick off Hispanic Heritage Month, which inspired our webinar today. This observation started in 1968 as Hispanic Heritage Week under President Lyndon B. Johnson and was expanded by President Ronald Reagan in 1988 to cover a 30-day period starting on September 15th and ending on October 15th. So for 50 years now, our nation pays tribute to the generations of Hispanic Latino Americans, which today stand at 57 million and come from many places, including Spain, Mexico, the Caribbean, and Central and South America. These are individuals who have positively influenced and enriched our nation and society. I invite all of you to visit Hispanic Heritage Month, and you will learn a lot about the history as well as the reasoning for celebrating Hispanic Heritage Month during this time period. So what better way for us at the campaign and the Center to Champion Nursing to celebrate Hispanic Heritage Month than by featuring the work of our friends and colleagues at the National Association of Hispanic Nurses, an organization that has been so instrumental to my own growth and development, as well as to thousands of nurses in our country. Hispanic Nurses, the National Association of Hispanic Nurses, have a wide range of contributions in leadership, mentorship, education, and practice. Their mission is focused on advancing the health of all of our country, but in particular, Hispanic Latino communities, and we will hear a lot about that today. Next slide. So I will introduce all of our speakers at once, and in order to get through all of our slides, I've shortened their bios, but I want you to know that a common thread among all of our presenters today is that they are all educators, they are all leaders, both formally and informally, they are all mentors, and they all practice. So let's start with Dr. Cuellar, Dr. Norma Cuellar. She is the current president of the National Association of Hispanic Nurses, so congratulations, Dr. Cuellar. She is a professor at the Capstone College of Nursing in Tuscaloosa, Alabama, and her degree from nursing is from the University of Southern Mississippi, her BSN. Her master's in nursing is from Louisiana Health Sciences Center, and her doctorate of science in nursing from the University of Alabama at Birmingham. She completed a postdoctoral fellowship from the University of Virginia in complementary and alternative medicine. Today, we are going to hear about two of Dr. Norma Cuellar's projects that she has received funding for, including the All of Us Research Program with the National Institutes of Health in collaboration with NAHN. In addition, she will share the exciting program that she serves as director for, funded by the Health Resources Services Administration, called the BAMA-L Grant. And in addition, I think it's important to also share with you that Dr. Cuellar is the editor-in-chief of the Journal of Transcultural Nursing. And there next to her, you see Cresta Archuleta. She is the non-executive director. And Cresta, I want to thank you for helping us organize this webinar. We really appreciate it. Prior to joining NAHN, Cresta worked as Director of Strategic Partnerships with the Hispanic Communications Network, where she carried project management duties for the National Institutes of Health Science Education Partnership Award. Cresta holds a Bachelor of Arts degree in Political Science from Colorado State University, so we will hear from her as well. Next slide. In addition, Dr. Angie Milan is a presenter today with us. She is a past president of the National Association of Hispanic Nurses, having served from 2010 to 2012. She is the first in her family to graduate college. Angie has been a dedicated nurse for over 25 years in Los Angeles, and she currently oversees over 300 nurses in her current position. She received her nursing diploma in 1986, followed by her BSN and MSN degrees from the California State University in 1990 and 1993, respectively. In 1996, Angie graduated from the Harbor UCLA Women's Health Nurse Practitioner Program, and she completed her DNP the summer of 2015 from Western University of Health Sciences. Since 1999, Dr. Milan has worked for Children's Medical Services in the County of Los Angeles Department of Public Health, first as Assistant Director and now as Director. And next to her, we have Susana Gonzalez. She is the current Associate Dean of Nursing of a new innovative initiative from Instituto del Progreso Latino in Chicago. Instituto has embarked on a new vision of higher learning for the community it serves. The first program for that vision will be an associate degree in nursing. Their mission is to contribute to the fullest development of Latino immigrants and their families through education, training, and employment that fosters full participation in the changing U.S. society while preserving cultural identity and dignity. Susana received her Master's of Science in Nursing and Master's in Healthcare Administration from the University of Phoenix. She is a volunteer, and I actually do want to share, all of them have such a long list of awards and recognitions for their work. But I do want to congratulate Susana. This year, she was named the Nurse of the Year for the National Association of Hispanic Nurses and Ambassador of the Year for 2018. So congratulations, Susana. We look forward to hearing from all of you and learning from you and beginning our webinar. So next slide. And Dr.
Hello,
Cuellar.
everybody. Thank you. Thank you for that wonderful introduction, Dr. Press. I, too, am so proud to be with this panel of speakers. They have worked in I can't tell you how many years. I guess together we easily have over 100 years of working with NON. But thank you to AARP and the Robert Wood Johnson Foundation for the opportunity to be a member of this panel. As a member of the Campaign for Action's Diversity Steering Committee, NON is honored to be a part of this webinar in honor of Hispanic Heritage Month. The national theme of this year's celebration is Hispanics, One Endless Voice to Enhance Our Tradition. We celebrate the contributions of Latinos not only in our country, but in Central and South America, Mexico, and Spain. Next slide. Today we're going to report on the 2018 County Health Rankings. And these health rankings are a collaboration with Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. It compares counties within every state on more than 30 health influencing factors. We're going to look at some of the things that directly affect Latinos. The trends will explore some concrete examples of some of the healthcare disparities that NON works to overcome. And some of these trends will include disparities, residential segregation, children living in poverty, and teen births. Next slide. The first thing that we all need to be aware of is the difference in some terminology. We're hearing a lot related to health equity rather than health disparities these days, and I just want to share with you the definition and make sure you understand. If you think of the word equity, it really means equality. So health equity is actually the ethical and human rights principle or value that motivates us to eliminate health disparities. Health disparities, we know that they are differences by different groups, whether they're ethnic, racial, by gender, by socioeconomic status. But the equity piece is that people don't have a right to receive health care or to receive anything that anybody else might receive. Next slide. So some of the things we're going to look at are the social and economic factors, the lack of access to preventative care, and lack of health insurance. And these are two very important factors that impact health disparities. The lack of health insurance, we made a very progressive leap with health insurance and Latinos when we had the ACA Affordable Care Act. And Alani, Adriana, you were very implemental in helping with that, with NON, and increasing the number of people that were Latinos that had health insurance. There's also issues of residential segregation, and if you think about this, certain people will live in certain groups, and sometimes that's good because cultures live together and they want to be together and they have things in common, but sometimes it's bad because then there may be things in those residential segregation areas that are not the same for other communities. We're going to talk about childhood poverty. We'll have a slide about that, but just to let you know that childhood poverty, we have a lot of our children that live in poverty. With this poverty, they experience higher food insecurity. and it just really impacts their healthcare outcomes, their education, all the things that would help them develop into young adults. The teen birth, we still have, Latinos still have the highest rate of teen birth, despite the fact that we have decreased substantially in the last 5 or 10 years. We also want to make sure that we realize all the other issues related that some of these things can impact as we become older or adults. And the Center for Disease Control and Prevention has cited that some of the leading causes of illness and death among Latinos includes heart disease, cancer, unintentional injury, stroke, diabetes, and these have high prevalence rates for Latinos. The obesity issue is also a major issue, and this, of course, impacts diabetes and cardiovascular disease. Next slide. So this is a slide that talks about education and looks at the percentage of ninth grade cohort that actually graduated in 4 years. And you can see that more than 1 out of every 5 youth in the bottom performing counties do not graduate from high school in 4 years. Additionally, the unemployment rate for adults in the bottom performing counties was more than double that of adults in the top performing counties. But the important thing is that among American Indian, Alaska, Native, Black, or Hispanic youth nationally, it's 1 in 4 that did not graduate from high school in a 4-year period. Next slide. Some of the social and economic disparities, you can look at the percent of population that are age 50 and older and who are unemployed. And, of course, this impacts many of the health disparities as well, because if you don't have money to go see a doctor, or if you don't have the transportation, or if you live in a area that the access is poor. So these social and economic disparities are very important. Next slide. All right, so this is talking again about residential segregation. And this is it's a very busy slide, but it's very important. So I hope when you, after this presentation, if you go back and look at this slide and really look carefully at it. But you can see how the policies and the programs that we develop at national levels in health policy relates to health factors and then relates to health outcomes. If we don't have people fighting for Latinos with this policies and programs level, we're not going to have the health factors and the health outcomes that are going to impact our families and our communities. So it's very important that we are involved even at this level related to health policy. And our organization is working very hard to promote health policy and to engage our members to be active in health policy. You know, nowadays it's not necessarily, you've heard it, it's not genetics. It's not your genetic code, but it's your zip code. And this is actually a theoretical framework or a conceptual framework that you can see that it really matters related to residential segregation, where you live, what you practice in your culture, the access you have to health care, and all of these factors here that contribute to that. Next slide. Again, these are just a description of the child poverty rates, and you can see that Hispanics and Blacks have more poverty rates than whites. And, of course, the rural counties are usually worse than urban. Next slide. And this is a slide that talks about teen birth rates, and I pretty much mentioned this earlier. If you look at the yellow line, you can see that we were the highest in 2006, and we've come down, and we're still higher, but we're coming down. So we're doing some good work. Our interventions seem to be working, but we need to work on it a little bit more. Next slide. So now I want to talk to you just a little bit about the National Association of Hispanic Nurses. We are a nonprofit organization. We have about 2,000 members. We have 44 chapters across the United States, And again, we're involved in issues that affect Hispanic nurses and the health of our Hispanic communities. And we do this both at the local and state level as well as the regional and national levels. We do a lot of mentoring and networking, and we promote collaborative and collective action by Latinos in nursing to strengthen their development in a caring and healing profession. Next slide. So this is our purpose, and this is actually a picture that we took at our national conference. We had the pleasure of having Dr. Jane Watson as our keynote, and if you look very carefully, she's sitting there in the middle of the table. But we celebrate the culture, the caring, and the spirit of Hispanic nurses who are the leading voice of health in our communities. And there's so many more of us, but this is I just think this is a great picture that really shows our members. Next slide. Our mission is also to provide our members with leadership opportunities, professional opportunities, and educational opportunities. Our main focus right now is really looking at leadership development and leadership opportunities. And one of the reasons is that we know that there are only 6% of our population, which is of the RN population, are Latino nurses, and we need Latino nurses at the table. We need them to be prepared to work in an environment that's going to have a lot of Latinos in our future, and there's going to be a lot of people that need help to help with that health care. So we need more Latino nurses to be in leadership positions. So we're really working hard for that. Of course, the professional opportunities and the educational opportunities, I think these all go hand in hand. Next slide. Our second mission is to advance the health care of Hispanic communities, and we do that through a lot of volunteerism. We are a community-based group. We know our communities, and this really has set us up to be successful in some of the research projects that we have been funded for. Our communities know who we are. They come to us for questions or when they need help or if they need health care access. Next slide. So here's some of our benefits. Of course, with being a member of NON, you have a connection to a wide Hispanic network of a variety of healthcare professionals that work in many different areas. We're very diverse in our professional activity, and we're very inclusive. We include many people in our organization. There is a chance to serve in leader positions. We are often notified or called, can someone be on our committee? Can someone be on our board? Can someone help us with this? So there's a lot of leadership positions. We're a forum for nurses to analyze and evaluate the health care needs of the Hispanic community. And we have opportunities to disseminate research findings and policy perspectives to impact policymaking and the allocation of resources. Next slide. Some chapter benefits. All of our chapters work very hard, and so they actually have fundraisers. So when you're a member at the chapter level, there's a lot of opportunity to qualify for local awards and scholarships. Again, a network support group, if you will, develops, and a lot of these, our chapters are like family. They just have worked together, and they support each other, and they help each other. So it's really very nice. Some of the chapter events include local conferences, leadership training, and networking reception. Next slide. So we have different types of membership here, but I want you all to know that if you are not Latino, you can still be part of our organization. Our organization is for anybody that wants to improve the health care outcomes of Latinos. So there are a lot of people that do research with Latinos that are not Latino. So we are actually a great networking for those of you that might be doing that are researchers. If you need access to a group, we're great for that. So, please think about joining our organization if you are interested in improving the healthcare outcomes of Latinos. But we have a general membership, a nursing affiliate. Our students, we we have about 30% of our membership is student because we do provide a lot of benefits for our students, and many of them continue on. They pipeline right into being a member. Our emeritus status, our corporate status, and then an affiliate status. Next slide. I want to briefly tell you about two of our next conferences. We have two conferences a year. We have our Latino Leadership Institute, which is the only Latino Leadership Institute for nurses, for Latino nurses. And we started that a year ago, so we're in our second year. This year it's going to be in San Juan, Puerto Rico, January 24th through 27th. And we're actually going to be doing a community service project the day before. We're not quite sure what we're going to be doing yet, but we think we might be doing immunizations to help people in San Juan. So it's a great opportunity to not only come to the conference, but to actually experience leadership in an area that still is a disaster area. The other conference is our annual conference. It will be July 15th through 19th in Reno, Tahoe, Nevada. We usually have anywhere from 400 to 500 participants. We'd love to have you come and get to know our members. You will feel very included. We practice inclusivity, and we welcome all to come to our conference. Next slide. I'm very proud that our organization does focus on research, and we have received several very important program grants that have helped our Latino communities. The first one is the NIH CEPA grant, and it's looking at Hispanic role models in health careers. And Angie Mian is the PI on that, and she's actually going to speak on that in a little bit. So I'm not going to talk about that too much. But this is a $1.2 million grant, and the results are going to really surprise you. They're really amazing. They're good. We're very proud of Angie and the work that she's done. The next grant is the NIH All of Us grant. As you know, this is related to precision medicine, and the trend is that precision medicine is going to transform how we care for patients in our country. And we've actually received 3 funding rounds, which totals about $300,000. Many of this money has gone back to the chapters where they actually their purpose is to increase the self-awareness in Latinos about the All of Us grant, because the All of Us grant is going to recruit 1 million people over 10 years, and they want it to be people that are underrepresented or minority groups. And if you don't know, Latinos have only been in 6% of clinical trials. We don't know enough about precision medicine for Latinos, and we can't just treat Latinos like in a homogeneous group. I think we're going to find that there's going to be very unique interventions that work for some and don't for others. And I think the results of the All of Us research grant will change how we practice medicine or health care in the future. Annabelle Castro got a $94,000 grant with Pfizer, and her role is improving adult vaccination practices among Hispanic Latinos that are 65 and older. So there's, I think, 12 chapters that are out, and they are teaching about the vaccination for older adults, and they're actually giving vaccinations to improve health care outcomes for Latinos. The HRSA grant is my favorite because it's one that I have received myself with the University of Alabama here at Tuscaloosa at the Capstone College of Nursing. It's actually to improve the nursing workforce diversity. As I said earlier, we know that there's just not enough Latino nurses. So the BAMA-L grant focuses on associate degree nurses, and we provide mentorship, we provide the education piece, we do resiliency training, we pay for them to come to the conference for mentorship, but most importantly, they get their tuition for the RN to BSN program, and it's all online. They can stay at their homes. We have our first cohort graduating in December, so I'm very excited. This is going to be a 4-year program. We can have 20 students per semester. So if you're interested or if you know someone that might fit this criteria, you can email me, and I'll get you some information. So the next cohort will be cohort 3, but we will not be admitting until next August. We only admit in August. Next slide. Okay, Dr. Mian.
Thank you, Norma. And I also want to thank everyone for joining us today. I also want to thank the Future of Nursing Campaign for Action for inviting us to share what NON is doing, and thank them for all the work they're doing to move nursing forward. So the NIH grant is a SEPA grant, which stands for Science Education Partnership Award. It's a 5-year, $1.2 million grant, and the purpose of this grant is to increase the number of Hispanics into the field of nursing. As you may or may not know, out of the 3 million registered nurses, Hispanics, when I applied for this grant about 6 years ago, we only represented 3.6% out of the 3 million RNs in the United States. Currently, I understand that the numbers have gone up. There's some stats that say 6%, some 7%, and we realize that that is the work of all of the nursing organizations out there trying to help us move our this work forward. So the project has several outcomes, but today I would like to focus on the media toolkit that this grant through NON has helped me develop. And the media toolkit is for the use of our membership to use when they're asked to present out at the schools, near their communities, at nursing careers, at health fairs, at high schools, and so forth. Next slide. So the first outcome that I wanted to speak on is our bilingual toolkit, and it's entitled Choosing a Nursing Career. And in the toolkit, it's a PowerPoint presentation, and it includes information about Hispanics in nursing. We actually show role models. We talk about reasons to be a nurse, nursing career options, nursing starting salaries, work locations, about flexible schedules. If they decide to be a nurse, how to do it step by step. We also include a little bit about why math and science matters, because we always get that question asked of us. We talk about the different educational pathways that they can take to become an RN, and of course, we do focus on the BSN, and we remind them or tell them that this is the best pathway to take. We talk about how to pay for college, and again, once the participant states that they're interested in hopefully becoming a nurse, we immediately connect them with a non-mentor. We have developed a nursing mentor database on our non-website, and the student participant can go on there and join so that they can be connected with a non-member. Next slide. The media toolkit was evaluated by an external independent evaluator. Her name is Dr. Castañeda, and she's from UC Berkeley School of Public Health. And she assessed the impact of the toolkit's PowerPoint used by the nurses, who are the presenters, and the evaluation measures the information gained by the participants, which is our audience, based on their survey responses. And we also looked at the social demographics. Next slide. So we had, for this first evaluation, we had a total of 246 participants from various cities throughout the United States. As you heard Norma mention, that we do have over 40 chapters throughout the United States. So we conducted the initial review of the media toolkit in Chicago, in Monterey Park, Los Angeles, in California, in Anaheim, in El Paso, Texas, and Phoenix, Arizona. Next slide. So who was our audience? Of course, the target was the Hispanic community. So out of the 204 participants, 185 were Hispanic. The remaining were of other ethnic groups, which included white, non-Hispanic, African American, Native American, and Asian. The audience was composed of, the majority were females. There was 171 females versus 66 males. And the age ranged from 11 to 20 years of age with an average of 15 years old. Next slide. The majority of the participants reported that they're currently in high school or have completed their high school diploma. Next slide. So what did they learn from the presentation? So 95% of the participants indicated that they had learned something new, and that's what we want. We want them to learn about all what nursing is about the opportunities that they do have out there. Next slide. The audience was also tested on their knowledge of the nursing field. You know, what we want to know, what did they learn from the PowerPoint? So 94% agree that they understood that nurses can work out of the hospitals and clinics. And as you know, the majority of people think that nurses only work at hospitals. So we want to clarify that myth. 82% also agreed that they understood that nurses do have flexible schedules. And we wanted to bring that up because we know that our membership, you know, does have family. They have other things going on just like the rest of the world. And we wanted them to know that nursing does have flexible schedules. It's not Monday through Friday, 9 to 5. We also wanted them to have an idea of what the nursing salaries were. And what we try to do here is, depending on what state we're speaking to our audience, is that we try to correlate the salaries with that state. And 50% agreed that nurses made more than $40,000 a year. Next slide. We also had a set of questions, and we wanted to ask them about the different options or pathways to get a nursing degree. And 69% of the audience agreed that a nursing degree was possible from a community college. And I just wanted to remind you that Hispanics' main pathway to a registered nurse degree is through a community college. However, we do know now that once they receive their RN degree, Hispanics continue to go on and further their education that lead to a BSN, an MSN, and even a doctoral degree. 88% agree that there are financial support for them to start or continue their studies, and 88% said that it was possible that they can continue on and get a master's and doctoral degree in nursing. Next slide. I'm very happy to see this one. A total of 63% of individuals showed interest in becoming a nurse. So again, once the student shows interest, we immediately connect them to our non-website, and we make sure that they enroll and get a mentor who is a non-member. Next slide. We also wanted to know what the speakers' comments were. We wanted recommendations from them so that we could improve our media toolkit. And some of the recommendations or comments that were made were that students or the audience were not clear on how to log into the portal to find a mentor, which we really want them to do. So they would like us to create a clear instructions on how to do this. They wanted us to incorporate two checklists for the toolkit, one detailing things that should be covered and one the materials required for using the toolkit. So they wanted us to give them a little bit more guidance on how to use the toolkit. They felt that there was a need to create a shorter presentation, maybe a 15-minute, because this current presentation is when we have at least 50 minutes to an hour to present. So they felt the need that maybe we should develop a 15, 30-minute presentation. But all the presenters liked the voice, the speed, the message, and the variety of radio spots. And what they're talking about here is at the end of the presentation, we have videos and radio interviews embedded in the PowerPoint, and I'm going to be showing you a sample at the end. Next slide. Continuing on with the recommendations and comments, one presenter thought that the PowerPoint should be shorter, which we just talked about, but they wanted us to know that they thought nothing should be omitted. So it's kind of hard for us to figure out how exactly we do that, but we're working on it. One presenter suggested that more information on advanced practice be included. For example, more about nurse practitioners, maybe anesthesiologists, and so forth. Different types of degrees besides the one that we currently do present, which is we do talk about the different pathways, the ADM, the BSN, the MSN. They wanted additional ones on that. All presenters believed that the PowerPoint was clear and caught the audience attention. There was an opinion that the PowerPoint was very colorful and well designed, so I'm happy to hear that. And none of the presenters used the newspaper editorial. We also include along with the materials is a newspaper editorial from one of our members talking about their experience, what they felt about nursing. And so I don't think that was a big hit. And one presenter did, however, use one of the nursing magazines and non-magazines to kind of show the activities of non. Next slide. So what I also want to share with you is that another component of the grant is that we recruit pre-licensed nursing students from across the country to become role models. We interview them during our national conference and to produce video and radio clips. The radio clips or radio interviews are both in English and Spanish and are launched during our campaign on several radio stations across the nation for a period of 2 weeks. We also develop videos, and these videos are used to be embedded in our media toolkit for the presenters to use. We also post them on our website so that anyone who comes and looks at our website can see our current role models. And we're going to show you a sample of one now.
I felt like I needed to have a purpose, so I decided, let me try nursing. Before I quit my job, because I had a good job, I want to see if it's something that I really enjoy. And you really have to love it in order to do well. So I decided to volunteer the moment I walked through the ER and just was able to help people that, you know, didn't actually have a support system or didn't have family, and I said, you know what, I'm here, I'm a volunteer, I'm going to help you get through this, or whatever I can do, I'm here. I knew I wanted to be a nurse at that point.
When you volunteer, they usually have you check in with the nurse, and they'll tell you what you can do or what you cannot do or what they need you to do. But I could see, like, what they did. They would, you know, give their patients medicine, their IV, you get kind of, like, you see the skills. It was just good to, like, witness it. Get your hands dirty, know what nursing is all about. That way you know what to expect, and you'll be ahead of the game in the first semester of the nursing program. Even just seeing patients in the environment that they're in, it's a huge help for when you're actually in nursing school, and just feel that confidence.
So that's one sample of one of our videos, and we have several, I think every year for the past 4 years, are listed in our NON website if you're interested in looking at any other videos. And the next slide. So how can non-chapter members and our community that's interested in helping us out? We need assistance with the campaign outreach efforts in utilizing our media toolkit, because we're going to continue to do one last evaluation this year, as this year is our 5th year and final year of the grant. And we want to encourage members to become a mentor by registering on our mentor database so that we have enough mentors that our mentees can sign up and be able to get a mentor. And lastly, just encourage interested youth to join non-mentor database as a mentee so that they can receive guidance and hopefully make their dream come true and become a registered nurse. So thank you for joining us today, and now I would like to hand it over to Susana.
Thank you, Angie. And I, too, would like to echo thanking the Future of Nursing Campaign for Action and their vision for diversity and inclusion. And what an honor it is to serve with you all. Next slide. So we want to talk a little bit about non-chapter engagement. Our chapters need you. You know, if you visit our nonnet.org, you'll find the information very user-friendly. You can search for local chapters. You can look and explore membership options, and we need volunteers. As an organization of volunteers, NON relies heavily on our expertise, our talent, our energy, our passion, and enthusiasm of all its members. And even in the slides you heard from the students themselves that volunteerism is the way to participate in an exceptional organization. Okay, next slide. So we think you could jumpstart your engagement at the national level. As the only national organization that represents Hispanic nurses, we're very active as a voice in healthcare. And we want to offer professional expertise by becoming corporate members and having people join our Council of Business Advisors. Look for sponsorship opportunities for visibility. You heard our president mention the Latino Leadership Institute, the national conference that's done annually. There are opportunities to be exhibitors, have a presence, host a breakfast, a lunch, be a keynote, and really work to participate to reach out to the nurses. Next slide. We have non-chapters throughout the USA, and you heard we fluctuate between 44 to 49 chapters at times. I like to look at the map because we can go from Alabama to Wisconsin, some states have more than one chapter, and others can probably use a chapter or two. And if you look on the slide, you will be able to log on, and then you can list by state, or you can actually click on and see who the leadership is at the local level. Next slide. So the non-chapter contacts are, again, easily identified. There are emails and phone numbers for the local areas and who their leadership is. If not, you can also contact our national office. Our director is Cresta. She's got a dynamic team of leaders that work to be very inclusive and supportive to the members, and by reaching out via email or phone. Next slide. So we wanted to throw in a little bit about starting a non-chapter. There are requirements, obviously, and we kind of always think that where there are 2 or 3, there's a group. And there's sometimes in a work environment, people can identify interested candidates that may want to form and affiliate and be a chapter. So there is a very extensive guidance on our site. We like our chapter members to participate locally and then be a part of the national as well. You know, we want to advance the health of the Hispanic communities and to lead, promote, and advocate. As you heard, lots of educational and professional and leadership opportunities. We need our members to collaborate and coexist and to elevate one another and support each other across the nation. Next slide. So with starting a non-chapter, we have a tool, and it is on how to start a chapter, so that it does exist, and you can go on the website, you can click on it, and you'll be able to tab down, and you can see the attachment. We want to make sure that our communities that could be served, and also that the team of nurses that work together as coordinators and points of contact can really identify with the mission, the vision, and the values of NON and why they want to be a servant leader in their local community. Next slide. So it's a little bit more about, how to start the chapter and how the coordinator or the nurse that wants to be the key delegated person and individual, we communicate very well via a base camp, and it's a form of network communication, and all its ongoing tools can be seen there, discussions, the business plan, and any form of communication can be worked on from base camp. And our leaders at the national level are very astute and comfortable working with the local chapters to continue that communication and leadership. So we want to encourage business plans and a little recruitment plan, and there's lots of guidelines from any of our chapters across the nation. Our next slide. So I give you our president, Dr. Norma Cuellar, who is eloquent and wonderful and easy to reach, and our executive director is amazing. Any one of these leaders, including ourselves on the webinar, are welcoming to your questions or seeking of information to be diverse and inclusive and want to serve and work with us. We want to welcome you and try to get you to any one of our conferences. So with this, the next slide, I want to make sure I defer back to Dr. Adriana Perez, our esteemed colleague, for some wrap-up and some words of wisdom.
Thank you, Susana. That was amazing. I know that everyone has learned so much about the work you're currently doing and have done, and I want to, before we open it up for questions, we want to pose a question to all of you, our audience, to help you think about how you will integrate what you have learned today from the national associations into your work. I can think of several things and have several questions for our speakers today. Before we do that, I do want to invite the Executive Director, Cresta, to join us and let you, Cresta, say a few words, especially about connecting, bringing this back to the county health rankings and how the rankings provide the context, how the rankings support the work that NAHN does. If you could share a few words with us and address our audience, that would be great.
Thank you so much. As we've hopefully communicated, NAHN addresses the largest healthcare challenges facing Latinos through our non-members who we believe truly uniquely understand the challenges to providing better health care to what is the fastest growing segment of the population, which is our Latino community. So the county health rankings provide NAHN with statistics and research that can bring actionable data to us at the national level and, more importantly, at the chapter level to help us identify challenges and opportunities for local health improvement. So these rankings provide data that assist our members in truly being change agents in their communities and in their profession. As we saw from the 2018 county health rankings, I think the main takeaways are that meaningful gaps still persist in health outcomes between counties in the U.S., in large part because of differences in opportunities for health. We saw that there's a clear connection between place, race, and health, and NAHN fills an important need in this intersection by connecting culturally competent healthcare professionals to Hispanic health issues and raising awareness and support. And we think this is really important for effective health policy and programs. So, we're happy to share more information about what we do at the policy and advocacy level because that's an important piece that we weren't able to cover in great detail during this session. Thank you.
Great. Yes, thank you, Cresta. At this time, I'm going to ask our operator to open the phone lines and provide instructions for our attendees to ask questions.
Thank you. At this time, I would like to remind everyone, in order to ask a question, please press star, then the number 1 on your telephone keypad. We'll pause for a moment to compile the Q&A roster.
Thank you. In addition, please remember that you could also use the chat box to ask questions. And to help us get started, there are a few questions and comments that I want to share. First, from my colleagues at the Center to Champion Nursing. We have 4 diversity consultants. All of us work with the 51 state action coalitions and often have questions from nurses working through our state action coalitions that are committed to promoting the diversity of our nursing workforce, both in practice and in academia. And so one of the questions, Norma, that I wanted to ask you, you did mention that you do not have to be Hispanic to be a member, and you don't have to be a nurse because you could be a nurse. You can be a member through your affiliate membership. One of the questions that we had was how many members NAHN has currently. Maybe you know that, or maybe Susana knows that. Mm-hmm.
Yeah, and Cresta would. Right now, we're close to 1,900, maybe 2,000. So that's all of the members. That's all of the members. Like I said earlier, 1/3 of those or less, around 1/3, is students, and we really value our student input and have them being future leaders for the organization. So yes, we welcome. Anybody that is working in these Latino communities that can impact the healthcare outcomes of our Latino families. It's where do we see healthcare going for Latinos in the next 10 or 15 years if we don't have everyone involved, everyone working together, being very positive and trying to impact the culture in a way. A big factor being prevention. And many Latinos do not get prevention. So we need people. Our organization doesn't have everybody that can help Latinos. We have a lot of people that help, but we need more. This is going to be such a big issue. so in our future, you know, and we need more people in our organization to help with this. And the reason why it's important to join NON is because other partners, other organizations know of NON, and they call us and say, "Do you have an expert in cardiovascular disease? Do you have an expert in nursing workforce disparities?" You know, or you know, they come to us. So if we have a pool of people that are experts in these areas, it provides better service to the Latino community. So you also don't have to speak Spanish. There are many of our members that do not speak Spanish, but we are from the culture, and we feel passionate enough about the culture that we want to work in the culture. So you do not have to speak Spanish.
No, but if you join on and you go to the meetings, you could learn Spanish, right, Norma?
Absolutely.
You could learn Spanish because you will hear everybody. And you gave us some very concrete ways, I think, that all of us could join and support NON, including the community service projects. And I think about what has happened over the last year with Hurricane Maria in Puerto Rico. So I'm very inspired by NON's work there. You talked about the leadership conference being there next year, the mentorship that is available. Of course, Angie talked about that as well, and the scholarships available through your grant. But also, can you talk a little bit more about the scholarships in general that NON offers, as well as the annual awards? Maybe you and Angie, or Angie, I believe you're the chair, right, of the scholarships and awards. Yes. So could you share that, Angie? I know that comes up a lot from our action coalitions.
Okay.
Yeah, I defer it to Angie. She'll do it.
Okay. So, yes. So we currently have several scholarships that we offer our membership. And one of the biggest ones is from the United Health Foundation. They provide $180,000 a year so that we can give around 19 multi-year scholarships to our students. We also have scholarships from a few organizations, for example, like Mercy, Health Services, and there was one more. And in addition to that, some of our past presidents also donate. So, for example, Dr. Hector Gonzalez this year donated $4,000. So those are individual scholarships that go to our members. And we continue to get many requests. You know, our members are in need of the funding, our student members, and there's still more need. So our organization continues to try to seek out more funding from other locations because, believe it or not, this is not enough. It's not.
Yes. Operator, do we have any questions?
We do, and if you would like to ask a question over the phone, please press stars and the number 1 on your telephone keypad. Your first question comes from Carmen C. Ramirez. Your line is open.
Great. Carmen?
Hi, everyone. How are you?
Hi. Good. How are you?
Hi,
Great.
Carmen.
Hi. I had a lot of questions, great information, but my big first question is for Angie and
Carmen, you only get one question. No, I'm just kidding.
Okay, one.
No, I'm just kidding. Go ahead. Go ahead, Carmen.
How do we get the toolkit? How do we start working with you?
Great.
Yes, so the toolkit is being placed on our website by our office staff. So I believe that as soon as it is posted, I believe that our executive director will send out email blast or notification that it is posted now, because I do have many people that continue to ask because they're ready to present, and we need them because we need 88 presentations made this final year. So we need your help, and thank you for asking, Carmen.
Sure. Okay.
Yes.
Thank you.
Carmen, yes, and feel free to ask other questions, Carmen.
Okay, well, I'll give other people a chance.
I'm just kidding. Operator, do we have other questions?
We do, from Raquel Womble Ortiz. Your line is open.
Excellent. Raquel?
Hi, this is Raquel from the Massachusetts Boston chapter, and the previous question was one I was going to ask, but now I have another question, and it's in regards to the media toolkit. In October, my chapter is going to be a part of the New England Minority Nursing Leadership Conference. It's the 4th annual, and the theme this year is mentoring. My chapter, I'm sorry to say, we don't have a formal, mentor-mentee at present, but I'm hoping to, have mentors and mentees very soon. So my question is, can I use the toolkit at the conference just to maybe do a little quick presentation on it, as part of a panel, because I don't actually have a official mentor, but just to show that NON does have this fantastic
great question,
program.
Raquel. Yes, great question. Angie?
Yes. Like I said, we're going to be making it available for everyone to use, and it'll be on our website for you to just hopefully go on there and be able to print everything out and just place the PowerPoint on your SUB so you can use it. Absolutely, yes.
Thank you so much. That's wonderful. Thank you.
Yes, thank you. Any other questions, operator?
There are no further questions at this time.
Carmen, did you want to ask another question? She might be on mute, and while we get her back on the line, I do want to follow up with you, Angie. A lot of the questions that we also have are about recruiting younger nurses, underrepresented nurses into our field. Many of our state action coalitions are working on promoting STEM careers, the health sciences in high school students and even younger. And so you shared a lot of information that I think could be useful to the state action coalitions. And I wondered, since the grant is, it's your 5th year, you have a lot of data that you've presented. What has stood out as one of the biggest lessons learned that you would share with colleagues that are thinking about recruiting younger people into our profession?
Yes. So I think the major lesson learned from these presentations in the grant is that we need to get our youth, our students, earlier than high school, because the focus has been young adult. We started out with young adults, and we said, okay, we need to get them at high school. But really, if we want them to have the science, the math, to be prepared to even start the prerequisites when they complete high school, we need to start putting that in their little heads in middle school. So the plan is that if we get any future funding, that our next focus will be on middle school. And that's going to be, again, on the science, focusing on science and math and the importance of it.
I think that's great. I wanted to add that Jerry added a comment to the chat box saying that adding to the question about scholarships, and this is a good point, several chapters offer additional scholarships at the local level. Those might have similar or slightly different requirements and different amounts of scholarships. So please do look at that for those of you that are in the different states as a way to promote those resources to your students and nurses looking for higher education. We do have another question from Melissa Rather to everyone. How does one sign up to be a mentor? My state does not have a chapter, and I am interested in doing more. Melissa, I'm going to turn that over to the members of NON to answer, but I do want to ask what state you're in so that they can help you a little bit more. So, Susana, maybe you could answer that question, or Angie, you talked about signing up as a mentor online, and then Susana, you could talk about, states that do not have a chapter. Oh, and you're in Georgia. Thank you, Melissa.
Georgia. Yes. So everyone is invited to be a mentor. We do request that you become a member of NON, and you can just go on our website, and on our website, there's a page that talks about careers in nursing. In Spanish, it says Carreras en Enfermería, and it's the Data Mentor Mentee. And you can sign up. It asks for a few questions about your profile. For example, how many days or times a month are you available to be seeked out by your mentee? Would you prefer that you do it by email, by phone, and simple questions like that. But we just want to get a little bit information, because that information as well, we're going to be collecting this last year so that we can do reporting on who are our mentors and who are our mentees. So absolutely, yes, anybody can become a mentor.
That's great. Thank you, Angie. And then, Susana, can you share a little bit more about the states? And I was surprised. I mean, even states like New Mexico, where we know there's a high number of Latinos, how one can start a chapter. Maybe just refresh us on some of the key milestones that must be achieved.
Sure. I sometimes always like to have individuals that are interested in NON to really join us at a conference, to actually really join us at Latino Leadership Institute. If you don't get inspired and motivated to start a chapter at one of those phenomenal conferences, then we're not really doing a really great job. So that's one way of getting motivated and inspired. And there's also, as we said on the webinar, reach out to us at National. Our president is open, our executive director. I work with membership committee, and we have the most amazing members across the nation that are very active and want to speak and support local individuals that want to initiate chapters. There is, as I said, on the link of our webpage, a how to start a chapter document. We can walk you through that. We are very open to communication. So that's a way to reach out to us, and we want to be supportive. There is chapter seed money that is given to individuals that complete the information and do some of the preliminary work that, again, we could guide you with. So,
great. Thank you so much, Susana.
Adriana,
go
I'd
ahead.
like to say something to Melissa as well. Melissa,
Absolutely.
I want you to know that there are a lot of people in Georgia that have said, I wish I could join a chapter in Georgia. So I think, and it's not only Latinos, but it's researchers that are working in the Latino population. I have a friend that does a lot of migrant health work down in southern Georgia, and she is very interested in doing something to start a chapter or to get to work, but she hasn't found people to help her or to get started. But she is, I think she's a member of our chapter. So I did want to say that the greater area of Birmingham has a chapter, and that's the chapter that I'm involved in. We do all our meetings. I mean, they meet in Birmingham if you can, but you can call in, you can dial in, and you can be at the meeting with that venue. But I would recommend that you join our chapter and then start thinking about ways how you can start your Georgia chapter and sort of break away. The Birmingham chapter could mentor you and help you get that started. Grace Grow has worked very hard to get the chapter growing and developed. She's probably, I think it takes sustainability. It means that the person that is a founder of the chapter has to be committed and motivated and really work hard. Now, I know that was not your question about how to start a chapter, but we're trying to get you to start a chapter. But if you want to join a chapter, I would recommend a chapter that is close to you, and that would be Birmingham.
And that's where you are, so thank you for that, Norma. We also have...
I'm in Tuscaloosa. but I'm in
kind of by there.
Yes.
You're kind of by there. In our chat box from Mary Dickow in California. Thank you, Mary. She says, thank you for for all of this important webinar. We just held a Minority Nursing Summit this past Saturday in Fresno, California. Very pleased to report that the San Joaquin non-chapter, along with the Philippine Nurses Association and the Hmong Nurses Association, helped support the event. It was a fabulous event with many students attending to hear about becoming leaders in their community. Thank you so much for that comment, Mary. We appreciate it. I know there are questions about interest in research grants, and we can follow up with you. You have our contact information. Mary also adds that it was great to have the local chapters of the association involved, and she feels that they made some real connections, helped to make some real connections for students. So thank you again, Mary. And from Cynthia, Dr. Cynthia Bienemy in Louisiana, she says, can you share a little bit more now on how the county health rankings will be used to address residential segregation and its impact on improving the health outcomes within these communities? So are you using the health rankings data over time to follow any changes? Maybe Norma or Krista, you could speak to this question.
Go ahead, Krista.
Oh, sure. So again, we are looking at the 2018 Health County Rankings report, and it's still something that's in progress. But I think, while we don't have any programs implemented thus far, these are one of the resources and benefits, really, of the strategic partnering with the Campaign for Action and these statistics. So we can then equip our chapters with this information, and they can do local community action programs. So as those programs become available, that's something that either the chapter would post on their website, or we would be disseminating through our distribution channels, our email blasts. So in short, that's something that's in progress. But great question about how you can take those different items. And that's really what we use, I guess, more so the takeaway is we would use that type of statistic in our strategic partnering to go out and where we may request funding so that we can be proactive about programs we would like to implement and then how to fund those programs.
That's excellent. Thank you for that, Krista. Operator, any other questions on the line?
We do have a couple. We actually have Mary Dickow on the line. Your line is open.
Great. Thank you, Mary. Mary, you might be on mute.
I was, sorry. I typed my comment in the box because I didn't think I was getting through on the line. So I appreciate the connection. But I think that's the importance of really engaging with our local chapters across the minority nurses associations. This was an event to really highlight the necessity of having more Hispanic nurse leaders in their communities. And so in order to get Hispanic nurse leaders, we actually have to build that from the ground up. So we had many students. Most of them were LVN students who came with some encouragement of their faculty member, which was really exciting because they left feeling very positive about the future of not only their education, but their role. And at the beginning of the conference, we asked them to raise their hand. Everyone in the room who thought themselves as a leader in their community raised their hand, and maybe 5 or 10 hands went up. And by the end of the day, after hearing from some phenomenal leaders across the state, every hand in the room went up, and that was just very encouraging for us.
So inspiring. Thank you for that, Mary. And I want to add that in the chat box, Krista did provide for all of us the link to sign up for those of us that are interested in Hispanic nursing, mentoring, and becoming a mentor. So thank you for that, Krista. Operator?
And we have another question from Raquel. Your line is open.
Thank you, Raquel.
Oh, hi. Hi, you're welcome. Thank you. My other question is about the mentor-mentee again. So does the mentee have to be in a nursing program to be a mentor, or can they just be, like, say, in a pre-nursing but already at a university?
That's a good question. Angie?
Yes. They do not, because we're making presentations at the high school, at adult career fairs and so forth, so they may not be in a current program. So we want to provide them a mentor to guide them into the steps and how to get into a nursing program and how to navigate that system.
Great.
Oh, that's
thank
wonderful.
You.
That's wonderful.
Yes, thank you.
Thank you.
Thank you. And thank you, Raquel. I want to circle back with Susana. Susana, you gave us really a step-by-step guide on how to start a chapter, what NON has done to build the organization and grow its membership, and it's been very impressive. Something I wanted for you to mention is the seed funding that is available, especially for attendees like Melissa that are contemplating starting their own chapter. I know that there are resources that you mentioned, but there's also some seed funding available. If you could talk about that, that'd be great. Susana? You might be on. Okay, yes, Susana might be on. She might be on mute, but go ahead, Norma.
So the seed money is not research money and it's not grant money, but it's money to provide to the chapter so they can use it to begin some of the things that they need for their chapter. So seed money is being used in a different way.
Mm-hmm.
Does that help?
It's a set amount, is that correct?
Yes, it's $500 to help them start a chapter.
Mm-hmm.
Right.
And one of the things that Susana had mentioned is that once those milestones were achieved, that they began a formal process, that they had so many members, that resource was available. I think that's another great benefit that many people don't know, and it just speaks to the investment that NON is making to each community to help, like you said, in seed funding, to grow a chapter and members that can help students and nurses throughout their career to advance and make an impact in their community.
Mm-hmm. Mm-hmm. With that note, I think one of the needs that we are working on, or that I'm working on, that I hope it will continue to grow, is we really do not have any research grants to help our members do research. And it could be a research grant for a student that's doing a dissertation, or it could be a research grant for someone that wants to do research but has no income. And that is one of our goals, to begin that process. So, and I think that's really important for a professional organization to have, a line of research, and that it's obvious that that's a very important goal for us. We do have the scholarships that are available, which are important as well. But those scholarships also fund master's and doctoral prepared students. So we just need to help them with their dissertations and continue in their research trajectory so that they can continue to identify the healthcare issues with Latinos.
Mm-hmm. Mm-hmm. Norma, I think that's a great idea. I know you brought that up too in our questions box. So this is starting. You have scholarships, academic scholarships, and you have recognition awards, but you're talking about dedicating a line item to research grants for students in doctoral education, so specifically dedicated to helping to support a scientific inquiry.
Right.
Is that correct?
Okay. And we have money for them, like scholarships, if they're asking for scholarships for tuition, or things like that. But we don't have anything, like you said, a specific line item for research. So I would really like to see that grow a little bit more, and we've got some things in progress to develop some research grants for that.
Mm-hmm. Mm-hmm. That's great. Thank you for that. Operator, any other questions?
There are no further questions at this time.
Okay, I also want to give an opportunity to our speakers to share any final words, anything that we might have not covered. Okay, and so I would also like to welcome Cresta in sharing any final thoughts with our attendees today, and reminding them about how to be able to obtain their continuing education credits.
Thank you. So just for housekeeping items, if you would like to obtain CE credits, please contact me at director@thehispanicnurses, the email address listed in the presentation. We will be able to process that in fairly short order. And then lastly, just to leave you with some thoughts about some of our upcoming events. I know we talked about the Latino Leadership Institute in San Juan, Puerto Rico. Everyone is welcome to attend. Under the events section on our website, you can find additional information about either being an attendee or a sponsor, or if you think your organization may be interested. It's a great way to come and get to know more about what NON does and really get to know some of our members and network in that way. So that's the next event coming up. And then the event after that would be our annual conference, which is in July 2019. Just in some parting thoughts, some things that we didn't talk about today are the committee work that takes place. So that's one of the benefits of becoming a member. But the committees really carry out a lot of the initiatives that NON undertakes. And we have an engagement committee that is sort of the outward-facing face and voice of NON, the education committee that oversees all of our events and webinars, awards and scholarships, as we were able to talk about, a finance committee, and this is really important to know that NON is very fiscally responsible, and so we have a robust operational arm that helps manage everything that we do and help keep us on task. The other committees that we have are bylaws and the Equity, Diversity, and Inclusion Committee, which is really important because we want to make sure that we are addressing healthcare disparities not only by race, but by issue vertical. You can find more information about the committees on our website, and certainly we welcome you at any time to join a chapter meeting. If you'd like to get in touch with the chapter, let me know. I'm happy to do that. Most chapters meet monthly, and it's a good way to get to know more about the local work. So with that, I will turn it back to you, Adriana.
Carissa, thank you so much. You mentioned the conferences coming up, and it reminded me of the videos that Angie shared. And when we talked yesterday, I was commenting that, for young students that are in high school and even those that are younger, those videos and the radio ads are so critical because seeing someone that looks like you, that is a nurse, that has been successful, could be life-changing. And I think that's why the conferences and the meetings in person are so impactful and could be life-changing. When students attend and are able to interact and make connections with other nurses around the country that look like them and that have succeeded and that have experienced challenges and have not only overcome their challenges, but have thrived as nurses. So I do encourage and wholeheartedly endorse the events through NON. So hope that all of you will consider joining and supporting those events. Our final slide, Scott, if you could take us there. Thank you. Dr. Quinn had to leave us a little early for another meeting, so she wanted me to make sure that I thanked everybody for joining us, for calling in, for being present through this webinar. As we mentioned, if you missed a section of the webinar or would like to pass this on to a colleague, a student, a friend, you can find the recording, which will be available in 5 days or so, and a summary of the webinar and any additional webinar resources by going to www.campaignforaction.org/webinars. As we mentioned, the National Association of Hispanic Nurses is a member of our Diversity Steering Committee through the Campaign for Action. Members of the Diversity Steering Committee include presidents of all of our underrepresented nursing organizations, including the National Black Nurses Association, the Native American Nurses Association, the Association of Men in Nursing, and others. Be sure to follow us on Twitter, join us on Facebook, and sign up for the weekly update also on campaignforaction.org. You will see a lot of your colleagues, old colleagues and new colleagues that you could make through these interactive tools. This has been a continuing effort within the Diversity Steering Committee at the Center to Champion Nursing in America. And just so you know, our members, all of the presidents, are meeting next month in October, right before the American Academy of Nursing meeting for our annual meeting. And we're so grateful to the presidents of the organizations. And Norma, you're a new member joining us as a new president now, so we welcome you. Your work today, this webinar, aligns with our efforts to feature the organization's leadership in promoting a culture of health. And as we've said from the very beginning, a culture of health aligns so well, especially with NON and our ethnic minority associations, because a culture of health is embedded within your mission. It's work you have always done. And so it aligns well with the culture of health, as well as it is grounded in the future of nursing goals for advancing academic progression, education, for promoting nurses on leadership boards and positions, and in practice. So we thank you for that. We thank the National Association of Hispanic Nurses. We encourage you and are behind you 100% in supporting your work so that you leave a mark and grow your legacy in contributing to the health of all Americans, and in particular Hispanic and Latino Americans, through Hispanic Heritage Month and beyond. We encourage all of you to continue to celebrate this month by considering supporting NON, joining NON, and your own communities, and being mindful, being aware of the disparities that exist within your own communities. So with that, I want to thank you all.